Welcome to Medicare 101, a comprehensive guide for 2026. Today's agenda includes an introduction to Medicare, a discussion about enrollment timelines. We'll look at the various parts of Medicare, what we call the Medicare ABCs. We'll discuss Medicare costs, and we will look at Medicare today as well as future trends. Medicare is considered essential medical health insurance coverage. It is a federal health insurance program for those over the age of 65 and for some people with qualifying disabilities. It's been around since 1965 under the Social Security Act. However, it's changed over the years as healthcare needs change. For example, Medicare Advantage Part C was introduced in 1997 and was significantly expanded in 2003. New Medicare rules in 2006 again expanded the program, and Medicare will continue to evolve driven by consumer demand, legislative changes, and technology. Medicare eligibility typically starts at age 65 for U.S. citizens and legal residents who have lived in the U.S. for at least 5 consecutive years. There are a handful of enrollment periods and deadlines, the most important of which is the initial enrollment period, which usually happens right around your 65th birthday. The Medicare program has many elements, including original Medicare, as well as optional private choices that work together. Your first step is to enroll in Original Medicare to establish your coverage foundation that gives you access to hospital and medical services. Next, navigate enrollment timelines depending on where you are in your Medicare journey, whether you're turning 65, retiring, or transitioning from employer coverage. Finally, you'll choose additional coverage options designed to safeguard both your health and your finances, helping you move forward with confidence and peace of mind. Let's start with the first step: how to enroll. There are two ways to enroll in Original Medicare: automatically or manually. If you are already receiving your Social Security benefits approximately 4 months before you turn 65, you will be automatically enrolled in both Original Medicare Part A and Original Medicare Part B. If you are not taking Social Security benefits yet, you must manually apply for Original Medicare, and you can do this by going online or in person at your local Social Security office. We highly recommend you enroll 3 months before you turn 65 so you can stay on track for your initial enrollment period. Keep in mind, if you are still working and choose to keep your employer-sponsored health insurance, you must actively decline Medicare Part B during your Original Medicare enrollment. This also applies if you are receiving Social Security benefits and continue to work while maintaining employer coverage. In these situations, some individuals are automatically enrolled in Part B, and eligibility alone does not stop that enrollment. If you plan to remain on your employer's health plan, you must manually decline or disenroll from Medicare Part B. This can be done by going online or in person at your local Social Security office. Medicare enrollment timelines matter because missing one can be costly. Enrolling late may lead to lifetime penalties, coverage gaps, or delayed benefits. Your enrollment window depends on factors such as age, employment status, current coverage, etc., and changes such as moving or retiring can create new enrollment periods or deadlines. The number one most important timeline is your initial enrollment period. For most of us, that is the 3-month window before we turn 65, our birth month, and 3 months after. Every year in the fall, we have an opportunity to make changes to our Medicare plan, and that is during the annual open enrollment period. For those of us on a Medicare Advantage plan, we have one more opportunity to make changes, and that is during the MA open enrollment period. If you decide to enroll in a Medigap plan, also known as a Medicare supplement, your open enrollment period starts when you first turn 65 or when you first enroll in Part B. Called the Medigap Open Enrollment Period, or Medigap OEP, it's an important timeline because this is the best opportunity to enroll in a Medicare supplement without being required to provide medical conditions or health status. The second key enrollment window is the Special Enrollment Period. This is triggered by special life events, making it especially important to pay close attention. For example, when you lose employer coverage, you typically have up to 8 months to enroll in Medicare Part B without a late enrollment penalty. However, Part D follows a different rule. You generally only have 2 months to enroll. Because these timelines don't always align, this is an area where extra planning and guidance can make a big difference. Additional special enrollment periods can be triggered by plan changes or your circumstances. Situations we often see include changes to your Medicaid eligibility or moving out of your plan's service area. Plan-related events such as a star rating change, plan withdrawals, or declared disasters may also qualify for a special enrollment period, allowing you to select new coverage without a penalty. These all typically provide a 2-month window to adjust Medicare coverage. However, because these timelines vary based on the event, understanding how and when a special enrollment period applies is essential to avoiding coverage gaps and penalties. If you missed your initial enrollment, your open enrollment, or any special enrollment timeline, you can still enroll in Medicare during the general enrollment period, which happens in the spring, January 1st to March 31st. It is important to note that your coverage usually doesn't start until July 1st. Understanding Medicare enrollment timelines, triggers, special enrollment periods, and deadlines is essential. The most costly Medicare mistakes stem from just a few avoidable errors, and some can result in lifetime penalties. The three most common reasons people miss their Medicare enrollment are not enrolling at the appropriate time, missing a special enrollment period, or delaying enrollment because they mistakenly believe their group health plan remains primary. Avoid unnecessary or unexpected costs and make sure your Medicare coverage begins when you need it without gaps or penalties. If you decide to continue working after 65, there are several considerations to remember that have everything to do with eligibility, timing, and coverages. If your company has more than 20 employees, your company's health insurance is the primary health insurance coverage. That means you can delay Medicare Part A and B without penalty. When you decide to retire, you get a special enrollment period, and the SEP allows you to enroll in Medicare Part A and B without any surcharge. If you work for a smaller company that has less than 20 people, Medicare is the primary health insurance coverage. That means you likely need to enroll in Medicare Part A and B to avoid penalties. Check with your HR department because they have a good understanding of the conditions and rules for your employer coverage. If you are contributing to a health savings account, it will be very important to stop contributing the minute you enroll in any part of Medicare. We recommend you stop the contribution at least 6 months before enrolling in Medicare to avoid any potential tax liability. You will still have access to your HSA funds, you just need to stop contributing. One thing to think about is whether there's a greater financial advantage in staying on your employer coverage with potentially higher premiums so you can continue contributing to the HSA versus stopping the HSA contributions and transitioning to Original Medicare. If you decide to retire but you're not quite eligible for Medicare, you might be eligible for COBRA through your company. However, keep in mind that COBRA is not considered creditable coverage and it could expose you to late enrollment penalties. Also, COBRA is not considered primary coverage, which means you could be responsible for medical expenses if you're not enrolled in Medicare. Another common oversight is that while COBRA does allow an 8-month enrollment window for Part B enrollment, the Part D drug plan enrollment window is only 2 months. Medicare has many pieces and parts. We like to think about this as learning about our Medicare ABCs. This is because the parts and the plan names are almost always named after an alphabetic character. As we move forward in this section, think about putting together your own personalized jigsaw puzzle to ensure that you have the best coverage that suits your lifestyle. The foundation of your Medicare plan is based on Original Medicare Part A and B. This is provided by the federal government and includes coverage for 80% of your medical expenses. Let's take a closer look at how Part A and Part B work. Original Medicare Part A includes inpatient hospital stays, skilled nursing facilities, hospice care, and some home health care. Caution! Be aware, Part A does not cover long-term care. Most of us don't have any cost for Part A as long as we have worked at least 10 years and contributed to the Medicare system. There is a deductible for Part A, and it could be triggered multiple times in 1 year if you have several separate hospital stays, and there is no yearly limit on these payments. You will also have coinsurance responsibilities during the year. If you are receiving Social Security benefits, then you are probably already automatically enrolled in Medicare Part A and B. If not, be sure to enroll during your IEP. Original Medicare Part B covers doctor visits, outpatient services, medical supplies, and preventative care. Part B has a standardized monthly premium, which might be higher if you are at a higher income level. If so, your Part B premium will be adjusted accordingly. There is a fixed annual deductible, and you will have coinsurance responsibilities during the year. If you are receiving your Social Security benefits, then you are probably already enrolled in Part B. However, if not, don't forget to manually sign up for Part B during your IEP. There are many Medicare private insurance options that work with or instead of Medicare to fill the 20% gap in original Medicare coverage. We will look at 3 important options separately. Medicare Part C is often called Medicare Advantage. Offered by private insurance companies, these are primary over Medicare, which means the Medicare Advantage plan is responsible for costs associated with your medical expenses by bundling Part A and Part B benefits to help fill the gap left by original Medicare. They may also include Part D prescription drug coverage. Costs and premium vary by plan, location, and insurance company. Depending on the services offered, many carriers offer $0 plans or low-cost plans that include co-payments and coinsurance. If your Medicare Advantage plan includes prescription coverage, you will have separate drug co-payments and drug coinsurance limits. You must be enrolled in both Original Medicare Part A and Part B before you are eligible to enroll in a Medicare Advantage plan. Enrollment is usually coordinated with your IEP, and every year thereafter, changing your Medicare Advantage plan occurs during AEP. Medicare Advantage plans often include additional benefits for dental, vision, wellness programs, etc. Some of the drawbacks are high out-of-pocket costs, limited regional networks, and plan-specific rules. Medicare Part D is prescription drug coverage offered by private insurance companies and is designed to cover the cost of drugs. Even if you don't currently take any prescriptions, it is critical to ensure you have drug coverage from either a Medicare Advantage plan or a standalone Part D plan to protect you against unexpected costs and help manage any ongoing prescriptions. Costs and premium vary by plan, location, and insurance company. Medicarriers offer $0 plans or low-cost plans that include co-payments and coinsurance during the plan year. To be eligible for a standalone drug plan, you only need to be enrolled in Medicare Part A or Part B. Enrollment timing is typically coordinated with your IEP, and every year after that, changing your standalone drug plan occurs during AEP. Remember to enroll when you are first eligible to avoid potential exposure to late enrollment penalties. By the way, if you are enrolled in a Medicare Advantage plan, your drug coverage is usually bundled into your plan at no additional cost. Enrolling in a drug plan benefits you by offering cost savings and helps manage high out-of-pocket expenses. Unfortunately, drug plans are limited by regional networks, and understanding plan-specific rules regarding deductibles versus copays versus premiums can be complex. And don't forget, if you don't enroll when you are first eligible, you may be subject to a late enrollment penalty surcharge. Medigap plans are also known as Medicare Supplemental or MedSup plans. These terms are all used interchangeably. Medigap plans are secondary to Original Medicare Part A and B. That means when you visit your doctor, take out your red, white, and blue card first. Anything that is not covered on Original Medicare will then be covered by your Medicare Supplemental insurance depending on your plan letter. Offered by private insurance companies, plans have been standardized by an alphabetic letter across all companies. Therefore, coverage associated with a plan letter is exactly identical regardless of the insurance company. Even though coverage by plan letter does not vary, premiums will differ based on your age, your eligibility status, location, and other carrier-specific criteria. For example, some carriers offer household discounts or they might charge more if you are a smoker. And if you enroll in a Medicare supplement when you are older using a special enrollment period, you could pay higher premiums. Deductibles and copayments are very low, but these will depend on the plan letter. You're eligible to enroll in a Medicare supplemental if you're enrolled in both Medicare Part A and B. Your Medigap open enrollment period, your OEP, is the 6-month window when you turn 65 or when you first enroll in Part B. This is called guarantee issue eligibility. And using your Medigap OEP for a guaranteed issue is very important to avoid having to answer medical questions or being charged more for a pre-existing condition or even being completely denied coverage due to health issues. Medigap plans are great because many plan letters offer extensive and comprehensive options, have very predictable costs, nationwide coverage, and no referrals. One of the biggest drawbacks is higher premium, as well as the need for a standalone drug plan, and many plans do not include any extra benefits. When comparing Medicare supplemental standardized plans, remember that original Medicare only covers 80% of your medical expenses, meaning you are responsible for the remaining gap, which is 20%. Your goal is to determine which of these Medigap plans best suits your lifestyle and financial goals. As you review the chart, notice that some plans have very little additional coverage, some offer a greater portion of coverage, and a few plans offer robust coverage, meaning you have very little out-of-pocket expense. Plan G is one of the most popular choices because it fills 100% of the 20% Medicare gap. Except for your Part B deductible, the Plan G Medigap Supplemental Standardized Plan is a great option to reduce your out-of-pocket expenses. Now that you understand how Medicare Advantage and Medicare supplements work, it's time to begin thinking about your options and decide which path works best for you. Don't forget that you need to be enrolled in Original Medicare Part A and B, and you also need to continue paying Original Medicare premiums every month. Some prefer the simplicity of an all-in-one bundled plan with added benefits and lower initial costs. Others value the flexibility, stability, and freedom of choice that comes with choosing coverage a la carte for medical services and separate drug coverage. What matters most is Medicare insurance that aligns with your health needs and budget. Medicare is excellent coverage and, in fact, quite comprehensive. However, Medicare doesn't cover everything all the time. Some of the things that are excluded might surprise you. As an example, Medicare only covers a maximum number of days in a skilled nursing facility. Once you require permanent custodial care, aka long-term care, you are responsible for 100% of your medical expenses after day 100. Even a Medigap plan will not cover long-term custodial care. Unexpected medical events also have many hidden non-medical expenses we forget about, such as transportation costs, lodging, lost wages, etc. A short-term care plan will help with caregiving services, and a hospital indemnity plan covers hospital stays. Both give you a fixed lump sum payment to cover where Medicare stops. Cancer or heart attack and stroke plans also pay a lump sum directly to you upon a diagnosis and are specific to the condition. For example, cancer versus a cardiovascular event. A broader critical illness plan might combine coverage for all of these, plus other severe illnesses such as organ failure, ALS, Alzheimer's disease, etc. Dental, vision, and hearing coverage is largely excluded from standard original Medicare. Even for Medicare Advantage plans that feature benefits for these services, coverage is usually very narrow and restrictive. Original Medicare Part A and B does provide limited coverage outside your service area and outside the country, but it is very limited. Without travel insurance, you would be responsible for 100% of the cost of emergency medical evacuation, other transportation, doctor visits, hospital stays, and prescriptions. All of these give you financial flexibility to manage unforeseen healthcare costs and help protect you in your retirement. Even if you are married, your Medicare costs are unique to you. There are many complex elements that contribute to your Medicare health insurance costs. They depend on the plan you choose, your income, and whether you enrolled correctly and on time during your initial enrollment period. One important thing to understand is that Medicare does not cover 100% of medical expenses. In most cases, you're responsible for approximately 20%, which creates a coverage gap that can be addressed with plans such as a Medicare Advantage or MedSup plan. How you choose to fill that gap will directly impact your monthly premiums as well as your out-of-pocket costs, including deductibles, co-payments, and co-insurance. The best choices are made by balancing your healthcare needs with your financial priorities. Income-related monthly adjustment amount is also called IRMA. It's an extra charge added to Medicare Part B and Part D premium. This is calculated automatically by Social Security using information from your federal tax return and very specifically, line 11, your modified adjusted gross income. IRMA is always based on a 2-year look back. As an example, your 2026 Medicare premiums are based on your 2024 income. Your transition to Medicare is an important planning opportunity. Coordinating with your tax advisor can help manage costs because large withdrawals from a 401k, pension, or RMD may unintentionally push you into a higher IRMA bracket, increasing your monthly premiums. Given that Medicare, IRMA, and tax strategies are interconnected, they should all be reviewed annually. The good news is that if an IRMA surcharge results from a life-changing event such as retirement, reduced income, divorce, or the loss of a spouse, you may be able to submit an appeal for reconsideration. Late enrollment penalties, LEPs, are permanent extra monthly costs added to your premium if you don't enroll in Medicare Part B or Part D when you are first eligible, or you go without creditable coverage for 63 days or more. Part B late enrollment penalty is 10% for every 12-month period you were eligible for Medicare Part B but did not enroll or did not have creditable employer-based coverage. The late enrollment penalty for Part D is 1% for every month you should have had coverage but did not enroll or did not have creditable employer-based coverage. Timing is everything. These penalties increase your monthly cost indefinitely and permanently, even if you switch plans. Be sure to stay on top of your IEP as well as any SEPs. Don't forget that you need creditable Part D coverage, and COBRA is not considered creditable coverage, which could trigger a late enrollment penalty. Be aware that if you drop out of original Medicare Part A and/or Part B, this could also trigger an LEP. Medicare today looks very different than it did 60 years ago. Recent legislative changes include the Inflation Reduction Act and the Big Beautiful Bill. Both focused on reducing drug costs, capping higher out-of-pocket expenses, and improving oversight to reduce fraud, waste, and abuse. While these goals are popular and important, the real-world impact is a mix of positive results and trade-offs. On the positive side, there are some meaningful improvements for those who rely heavily on prescription medications. First, Medicare added automatic enrollment into the Medicare Prescription Payment Plan, sometimes called the M3P, which allows beneficiaries to spread high prescription costs across 12 months instead of being hit with large bills all at once. Second, Medicare can now negotiate prices on select high-cost drugs, including well-known medications like Eliquis, Enroll, Xarelto, etc. These changes are especially helpful for people with chronic conditions and high medication needs. The trade-offs that no one talks enough about are that these improvements didn't come without consequences. One major downside is that costs for Medicare Part A and B continue to rise, including premiums and deductibles. So even as some drug costs may stabilize, monthly and annual healthcare costs are still rising. Another impact is on Medicare Advantage plans. Many have cut back or reduced extra benefits like dental, vision, meal programs, over-the-counter allowances, wellness programs, etc. Finally, we've seen many Medicare Advantage PPO plans exit most markets altogether. This means few choices, more disruption, and in some cases, beneficiaries being forced to change plans even if they were satisfied. So while the intention behind these laws was to help seniors, and in some ways they absolutely do, the reality is more complex. What worked last year may not be the best fit for this year and may not work out so well in the future, especially as these legislative changes continue to roll out. That's why reviewing your Medicare coverage every year is no longer optional, it's essential. Medicare is constantly changing. While today's healthcare ecosystem is modernizing, ongoing challenges are plagued by complexity, high costs, and fragmentation, straining access to care, particularly for those who qualify for Medicare and Medicaid, low income subsidies, and disability benefits. Artificial intelligence, telehealth, and electronic health records continue to expand, allowing more access to remote healthcare services. These changes bring improved diagnostic accuracy, administrative optimization, quality of care, coordination of care, and the reduction of medical errors to ensure continuity of care. The Medicare Advantage Health Equity Program will be rebranded to the Excellent Health Outcomes for All in 2027. This program is designed to incentivize and encourage Medicare Advantage and Part D drug plans to improve care for the most vulnerable. We're ready to talk about what's next in your Medicare journey. You've completed Phase 1, your Medicare education, by attending this online training. Now it's time to schedule your free consultation to discuss your specific situation and begin to compare options based on your location and health insurance needs using our Medicare Roadmap and Medicare Cost Summary tools. Once you've made your decision, we offer free lifetime billing and claim support, as well as free annual reviews to ensure nothing slips through the cracks. Every year, we compare plan options, confirm your providers and prescription drug coverage, and help you stay on top of plan changes and enrollment deadlines. Navigating Medicare isn't like signing up for a gym membership or switching internet providers. It's one of those big lifetime decisions that impacts your health, your wallet, and your confidence in your future. Schedule your free consultation because the choices you make now affect your healthcare and how life feels for you in the years ahead. Working together with you, we'll design your customized step-by-step guides, including your personalized Medicare roadmap that includes timelines and reminders, and your Medicare cost summary, which is tailored to your specific Medicare choices. There is no pressure, no obligation, just education. Move forward with confidence and protect what matters most, you.